Welcome to Aging Untold. If you're an older adult managing one or multiple health conditions, chances are your medicine cabinet is full. Keeping track of your prescriptions and over-the-counter drugs can be overwhelming, and when medications aren't taken correctly, the consequences can be serious. Seniors 65 or older visit emergency rooms more than 600,000 times each year because of medication misuse. So Ray, what's the first step to getting a handle on this?
Well, you need to take inventory. You need to know what all medicines you're on and have a list. And not just the prescription medications, but also the list of over-the-counter medications, especially supplements, because they actually can interact. So as you're older, you're not going to metabolize medicines as quickly as you used to, so it's a higher risk for everything to kind of interact. So this polypharmacy, so to speak, is a real phenomenon. And so you can see people with falls and dizziness and confusion and all that, and you don't really know what medicines they're really on. The other thing is, as physicians, you really need to go through that list with them carefully and reevaluate their medical conditions. You know, I've had instances where people have been put on certain medications and they've never been looked at again. And their conditions change, so that's very important as well. So what used to help you may actually be hurting you.
And that happened to my mom. She was put on a blood thinner after her heart attack and her heart surgery, and the cardiologist left that medicine on. Her primary care knew she had been taking it short term. The pharmacy kept calling it in for a refill. The cardiologist office kept refilling it. 2 years later, she's bleeding out and having issues because she should have been off the med in 6 months. And it was a culmination of errors. So you have to realize that, you know, one missed dose, one double dose, it can turn a really good day into a hospital ride or
We see that a
ambulance
lot
ride.
with statins. They put people on statins for high cholesterol and they just leave
them.
But if your cholesterol gets too low, you start having memory issues.
Right. I think people need to remember, if you have multiple doctors, you have multiple medicines, you have multiple amounts of time to get into an adverse reaction.
Sure do.
The other thing that I don't think people know about is there's a profession called senior pharmacy. There's pharmacists that specialize in older adults and their medications. So you should take advantage of that if there's one in your area. The American Society for Consultant Pharmacists, I think, is the name of the organization. But take advantage of that, and then realize that 18 to 20 prescription drugs annually is the number of prescriptions, average number of prescriptions that people 65 and older take, which is
Plus the
staggering.
supplements you don't know about.
Plus the supplements you don't know about.
Right. And there are some pharmacies that will actually sort those meds and put them in the pill packs. So they are dose-wise. The problem comes, and the biggest one I see, is when there is that hospitalization, and then the hospitalist comes in and jacks all the meds around, DCs, discharges off a bunch of meds.
Yep.
They're still in the pill containers at home. They're still in the medicine cabinet. Send you home with an entirely new list, and then you're trying to make those adjustments. You've got to build a system now that's going to catch that mistake before it catches you.
It'd be confusing for anyone,
Oh,
let
it
alone
is.
someone that has medical challenges or cognitive challenges. So absolutely. And I'm not exactly sure how this happened, but a cardiologist had recommended a medication for my husband, and a pharmacist was trying to be helpful and said, use this instead. And the cardiologist was not too happy later on when he found out.
Well, what happens is you have to, there's a box on there that says DAW, dispense as written. And if you don't mark that, they can substitute it with any generic, and they frequently do.
Well, if we jumped back to the hospitalization, I'm so glad you brought that up. Like, if you're a caregiver, go into the hospital with the list of medicines that they're on, look at the medicine at the hospital, and then wherever they go, match those two and make sure that they're back on the medicines that work for them, particularly if there's a psychiatric condition.
Right, right. And be careful when a hospitalist DC's off meds, make sure you follow up with your primary care really quick. And I always tell everybody, one single pharmacy, don't go to Rite Aid and another or whatever it's out there now. I know they're closed, but getting those weekly pill organizers, even for those of us that don't have a cognitive issue, they actually keep us on track. And you've got to have that master list and check it all the daggone time.
Somebody's got to be good at managing
Yeah,
it.
this
That's
is
just all
tough.
there is to
Yeah.
it.
That's
and you
really
can
important about the pharmacist, because the ones who know you, because that's the only place you go, they know the medicines you're on, they know the interactions, and many times, even as physicians, we don't know the other things that they forgot to tell us.
So let me speak for the older person who has a really weird system for their medicines. And if it's working for them, let them do it as long as they can. You know, the little pill by the bedside, and then there's another pill by the orange juice glass, and another pill by the coffee pot, and they remember to take their medicine. Well, allow that, because at least you know it's successful.
And that's okay until the grandkids come over. So if you're visiting an older person, and I put this out there around every holiday, if you're visiting and you've got small children and you're going to your loved one's house, always look for those hidden pills in the couch cushions,
Good
because
point.
that turns into a really bad
Yeah,
day and
right.
a real
Yeah.
big hurry.
Good point.
Right.
So it might be that grandma can manage her medications a certain way, but over time may not be able to manage it as well. So I'd like to say it's a process, not an event.
If you have a caregiver or somebody else who's coming in and all that, it's so important for them to sit down and really look at what they're taking and have an understanding of why. And
Oh.
talk to the physician or whoever the provider is to know why.
Yeah.
And because sometimes what happens, they end up having 2 medications for the same problem.
Exactly.
That's right.
Exactly. A lot
It's
of times.
complex, and
Yeah,
that's why we
it's
call
super
it
complex.
medication management. Still much more to come on Aging Untold.